Why are swallowing assessments important after a stroke? Imagine suddenly having trouble swallowing your food or drink after a stroke. This common problem, called dysphagia, affects many stroke survivors and can lead to serious health issues. Swallowing assessments are vital because they help identify who is at risk of choking or inhaling food into the lungs, which can cause pneumonia. Pneumonia is a serious infection that can make recovery harder and even threaten life. Most stroke patients experience some degree of swallowing difficulty. Studies show that between 22 and 65% of stroke survivors have trouble swallowing, and this can last 4 months. Early assessment is crucial because it allows healthcare teams to figure out how well a person can swallow right after the stroke occurs. These assessments are usually done within the first 24 to 48 hours when the patient is awake and able to cooperate. The assessments often start with simple bedside tests, where a speech-language pathologist observes how the patient swallows small amounts of water or food. Sometimes, more detailed tests like video fluoroscopy are used. This test involves taking moving X-ray images while the patient swallows different textures of food and liquids. It helps detect even subtle swallowing problems that might not be obvious at first glance. Knowing a patient's swallowing ability helps decide the safest way to feed them. If swallowing is difficult, the patient might need thickened liquids or modified food textures to prevent choking. In some cases, a feeding tube might be necessary to ensure they get enough nutrition and hydration without risking aspiration. Regular reassessment is important because swallowing function can improve or worsen over time, and treatment plans need to adapt accordingly. Swallowing assessments also consider cognitive and communication abilities. If a person has trouble understanding or following instructions, it can affect how they manage their swallowing safety. Speech-language pathologists tailor strategies to each individual, considering their neurological and cognitive status. Overall, these assessments are a cornerstone of stroke care. They help prevent dangerous complications, support proper nutrition, and promote recovery. By identifying swallowing issues early, healthcare teams can intervene promptly, making a big difference in a patient's safety and quality of life. Always remember to consult healthcare professionals for personalized advice and treatment options.